Oh, good afternoon, everyone, and welcome to using the DSPT for the first time. My name's Alan Wilmot, and I'm presenting the session this afternoon on behalf of the Better Security, Better Care team. I'm just going to wait for a couple of seconds just to make sure we've got everyone here who's supposed to be here, and then we'll kick off with the program per se. Okay, so I think everyone's here who's going to log in immediately. So just by way of introduction, just want to put your mind at rest in terms of how we're going to approach the session this afternoon. Um, we're not going to run through each question on the toolkit, but we will be signposting you to various support that's available, etc., as we work through. And just kick off with a few technical issues regarding the webinar. So this webinar is for care providers who have never published DSPT in the past. So it's primarily aimed at social care providers, and it's primarily aimed at those who haven't worked with the DSPT previously, although of course everyone is welcome to the session. Again, attendees are on mute and can't be seen. So the only thing that's on screen is myself and the slide. Um, if you do have questions as we work through, could we ask that you use the question and answer function to use those? And if you're viewing the webinar on a phone, in order to do that, you would tap the screen to see the controls, choose more, and then question and answer. If there are questions that we can't answer immediately, um, we will come back to you, we promise, if you add your email to the question and answer. The webinar itself will last no longer than 1 hour, and we will make sure that there is time for questions, etc., as we work through. And you will get access to the recording and the presentation, which includes all of the links that you require. So moving on to the program, what do we plan to cover this afternoon? Well, welcome and introductions we're into at the moment. Then we'll be moving on to the registration process for the DSPT, and we'll move through that fairly quickly. We'll then look at how you complete the DSPT, which will include a look at the questions, how they work, and your example responses, etc. And then having completed the DSPT, what do you need to do in order to publish your response? And then how you can use the DSPT within your work. And throughout the program, we will be covering the support that's available from the Better Security, Better Care program. So just a quick reminder, please use the Q&A, not the chat, for your questions, because the chat will come up on screen. And then just one last thing we would like to do before we get into the program proper. We'd like to gain an understanding of who's here this afternoon. So we'd be grateful if you would answer a few questions. So just respond to the poll that's up on the screen. Fairly straightforward questions. Are you already registered on the DSPT? If you are, have you started to complete it? And how would you describe your organisation? Is it a single site or multi-site organisation? So if you'd like to just tick on the appropriate responses, we'll just wait for that to work through, and then we'll just get an idea of who's with us this afternoon. Okay, so when everyone's had the opportunity just to respond to those three questions, we will have a look at who we've got here today. So about a third of participants are already registered on the DSPT, so 2/3 of you either don't know or not. Again, about a third of you haven't completed the DSPT previously, and most of you are, half and half in terms of multi-site or single site. So we will be covering all scenarios as we work through. So just before we start with me talking at you, let's have a quick look at a video which should explain why the DSPT is useful and what the benefits to you as an organisation will be. It just runs for a few moments.
Better security, better care with the Data Security and Protection Toolkit. As a care provider, you store and share important and often sensitive information. This includes data about the people you support, their family and carers, through to staff, partners and funders. To store and share that information, whether it is on paper or digitally, all care providers must have systems in place that reduce the risk of cyber attacks and information breaches. If you don't, your business and reputation could be at risk, and you could be breaking data protection law. The Data Security and Protection Toolkit, or DSPT, is an online self-assessment tool. You can use the toolkit to check your data and cybersecurity policies, procedures and practices, and demonstrate that you have good systems in place. This can reduce the risk of a data breach and the risk of a fine if a breach occurs, as you will be able to show the Information Commissioner's Office the steps you are taking to reduce and manage risks. All adult social care providers in England, regardless of size, service type or ownership, should complete the DSPT at least once a year. When you have completed the toolkit, you can publish and share information about the standard you have reached. So what levels can you reach on the DSPT, and what do they mean? There are currently 3 levels on the DSPT. Approaching standards means you are meeting minimum legal standards. It's a temporary stepping stone to the next level, and you will need to produce an action plan to show what you will do to get to standards met. Approaching standards also enables you to get NHS mail, an accredited secure email system, which helps you to share confidential information with local authority, NHS, and other colleagues. Standards met is the level you really need to reach. It demonstrates that you are going above basic legal requirements, and it helps you to take some proportionate measures to protect you from cyber criminals. It will help you to reassure people who use your services, their families, and your staff that you are managing their information safely. It will also enable you to answer the Care Quality Commission's questions about managing data. And if you are accessing NHS patient data or delivering services under an NHS contract, you must have reached standards met. Local authorities are also increasingly asking for the DSPT in their contracts. Standards met opens up access to shared digital systems with other organisations, including GPs, hospitals, pharmacists, and the CQC. It underpins the government's programme to digitise social care. Finally, standards exceeded indicates that you have gone beyond required standards. So, for example, you may have Cyber Essentials Plus in place. As a care provider, you should complete the DSPT at least once a year, but we know that not every care provider feels confident about using the toolkit. To support you, the NHS-funded Better Security, Better Care programme provides direct support, as well as useful guides, templates and a helpline to enable you to publish your DSPT and to protect the vital information you store and share. To find out more, visit www.digitalcarehub.co.uk/better security, better care.
Okay, so hopefully that's given you an overview in terms of how the DSPT can help you. So let's start to look at how it works and what you need to do in order to complete it. So if we take a look at this broad overview of the DSPT, we can see that it's a linear route and it's fairly straightforward. And you can see that, as it said in the video, that you should be aiming for standards met. But if you really can't get there in one go, then approaching standards is a step you can try for the first time whilst you're trying to address any issues that may have arisen whilst you were working through the toolkit. You can only publish at approaching standards once. And it's worth stating that because things change all the time, you can access the DSPT anytime you like to reflect changes that may have happened within your organisation. So you may switch from paper records to digital social care records, etc. And you can reflect those changes in your DSPT anytime you like in order to keep it up to date and keep it current. So we will have a look at this in more detail as we work through, but just to say that there is the first step of registration, then you complete the DSPT by answering all 45 questions if you're going to standards met or standards exceeded. And again, as mentioned in the video, it is intended to be an annual process that you work through to make sure it is current. And then you publish your responses either at approaching standards just the once or on an ongoing basis at standards met if you're meeting the full requirements, etc. So we're going to cover that in detail as we work through, but please remember that there is lots of support available to you out there in terms of working with the DSPT. Better Security, Better Care is the official partner to the DSPT, and the programme is paid for by the NHS. And within Better Security, Better Care, it includes online guidance and templates, etc., all of which is free and official. There are step-by-step films. There are webinars, recordings of webinars such as this, frequently asked question places. There are template policies to help you to respond positively to the questions within the toolkit. There is a helpline, and importantly, there is tailored support from 32 local support partners across the country, where there are real people who can help you with real situations, and they will even help you complete the DSPT should you require it. All of this is available on the link that's at the bottom of the slide there. Another key reason for completing the DSPT is a response to CQC and their requirements. CQC are increasingly expecting good providers to comply with the Data Security and Protection Toolkit as a minimum. And that includes whether you use digital social care records or paper record systems. And it is now a requirement under the single assessment framework, under the well-led governance, management and sustainability domain. And you can see there is a link at the bottom. If you want to review what CQC are saying about DSPT, follow that link and it will take you through to their particular guidance in terms of what you should do and how you should do it. So broadly speaking, that's the context for DSPT, why you should do it, how it helps you as an organization. So let's now move on to look at the how can you complete it. So as we said when we looked at the overview of the DSPT, the first step is registration. And if you haven't already registered, then you will need to do that before you can move forward. So how do you register on the toolkit? The first thing is to find your ODS code. All CQC registered social care providers have an ODS code, which stands for Organisation Data Service Code, which is in essence a unique identifier for each service. And the NHS will issue that for every CQC registered provider that exists. So if the first stage is to find your ODS code, the second is to choose which one you're going to use to register, then complete the registration process. They will then send you an email with a link in it that will allow you to set up an administrator for the DSPT and set up a password, etc. So it's a fairly straightforward process in terms of registration. The only critical bit is knowing which service it is that you're registering, which is defined by your ODS code. So let's have a look at more on ODS codes to make sure that you're able to use the right one. So in terms of what codes there are, as I've already said, every organisation has an ODS code. And in fact, every registered organisation will have two ODS codes. They will have a code for the head office and a code for the sites that relate to that head office. So if yours is just a single service or a domiciliary care agency with a single registered office, then you will register with your V code, not the HQ code. The HQ code relates to the registered office. The location code starts with a V, and that's the one you should use for the DSPT. So single sites, just register with the V code, ignore the HQ code. However, if your organization has more than one service, so if you are a multi-site with a group of care services that share the same policies and procedures, and that's a really important point, because the DSPT relates to confirming what policies, procedures, etc. you've got in place. If you register with your HQ code, you should be able then to link all of those sites under the one DSPT code. So you'll only need to complete one DSPT for all services, providing they have the same policies and procedures. So if you are a multi-site code, register with your A code or your HQ code, which will then link all of the V codes with that particular completion of the DSPT. If you are a more complex multi-site organization, so you might have several branches and or more than one type of service, so you might have care homes and domiciliary care or home care, then it gets a bit more complicated in terms of how you can best do that. And so it might be best to seek advice from the Exeter Help Desk, who will be able to advise in terms of what's the best approach. If you're not sure, then talk to your local support partners or to the Better Security, Better Care programme or the Exeter Help Desk, all of which are experts in this field and will know how best to advise for your specific situation. But for the vast majority of providers, we're talking about registering with your V code, which is the location code. Some recent changes that have been made have made it more friendly for larger organisations. So from 23-24, the DSPT now gives you the option to link the services that relate to your HQ code in a fairly straightforward way. So if you've registered with your HQ code, you will see what's on the right-hand side of the screen here. And you can see that down towards the bottom of that, it asks you what services you wish to link to this publication. So you can select all of the services that are linked to that particular HQ code and ensure that the one DSPT entry will cover all of them. Again, bearing in mind that they have to have the same policies, procedures, etc. It's also possible to add your registered managers as viewers and auditors of your DSPT. So if the publication is published at your headquarters and you want your managers and other personnel within the locations to know what you've published, you can add them as viewers to the service, as I'll explain later. And it's also possible to revisit and republish again for all services linked with that one HQ code. So whilst mentioning the changes, there are a couple of new elements for the DSPT that I'd like to touch on. So if you have looked at it in previous years, these questions won't have been there. They have been added for the year 25-26. So they've added a question 431, which asks, have all administrators of your organization's IT systems signed an agreement to hold them accountable to higher standards? So this question is about ensuring that those with greater access and responsibility within the system understand that greater responsibility they have and that they agree to maintain higher standards in terms of protecting the personal and confidential information. They've also added question 711, which refers to having an asset register detailing the organization's hardware, software, data, and keeping that up to date. So when it talks about an asset register, really what we're talking about is just having a list of the various devices or systems that your organization uses and making sure that they are fit for purpose. So it is a list of your hardware and software, that you should be reviewing it at least annually, and it can be combined with your information asset register, which is another question within the toolkit. If you're not sure about assets and what you should be doing with them and how you should be monitoring their use and how up to date they are, etc., the link at the bottom of the slide will take you through to the Digital Asset Management Guide that's available on the Digital Care Hub. So if we then go back to ODS codes, if you're not sure what your ODS code is, or you've never heard of it before and you want to find out what it is, the links on the slide will help you to do that, or you can search the ODS portal. So if you just Google ODS portal, choose your organization, it will then list the code next to the name of your organization using the postcode, etc. If again you're not certain and you're having difficulty working out which one, because there are some anomalies around ODS codes occasionally. So for example, a non-regulated service may not have a code, so you would need to contact the Exeter help desk to apply for a code. And if the service has recently changed registration, then sometimes there's a delay between the registration update and the ODS codes being published. So sometimes the ODS codes don't appear. And if that's the case, either your local support team or the Exeter help desk will be able to unravel that and help you through it. So the registration process, you need your ODS code. Once you've got that, what do you need to do? The next thing you will need to do is to go to the toolkit itself, and you can see on the left-hand side of the slide here, there is a link that will take you through to the DSP Toolkit NHS UK, or you can just Google DSPT and it will take you through to the home page. And when you get to the home page, you can see circled on the right-hand side a couple of options. You can either go straight to the registration process if you're certain that your organization hasn't registered previously, or if you want to check whether the toolkit has been registered or completed previously, you can go to organization search, and that will give you the opportunity to search your organization and see what status it has within the DSPT. So once you've clicked on the register button, it will then take you through to the process to registering for a new account. And it will start to ask a few questions about your organization. So the registration process will ask for your ODS code, so the unique identifier will tell them which service it is. Once you start the registration process, it will ask you to complete an organization profile. The first step in that process is to choose the type of organization you are, because the DSPT applies to all health and social care organizations. So we would suggest if you are a social care organization, you need to choose social care as is indicated by the arrow on the slide. If you choose social care, it will then strip out questions that are not relevant for a social care organisation and make sure that it asks about the appropriate roles, etc., within your organisation. The registration process will also then ask you about key roles within the organisation, such as data protection officer, CSIRO, Caldecott Guardian, information governance lead, etc. If you're not certain that your organization either has those or who they are, then you can leave those questions blank. It won't prevent you from proceeding to the DSPT questions. So if you're uncertain or you don't know, it's best to leave the other questions blank and move forward to the questions. If you do know, then fine, respond appropriately. It will then also give you the opportunity for whoever is completing the registration process to choose an administrator for the organisation. So if we can move to the next slide, please, Cyrus, thank you. So in order to set up other users, the administrator has the ability to manage users, add or edit evidence, and publish. So the administrator has full access to all of the DSPT. So whoever you set as administrator is basically managing your DSPT process. However, the administrator can also appoint members of the DSPT who are enabled to add or edit evidence. So, for example, if you have an IT expert within your organization who wants to respond to the IT questions, you can set them up to give them access to the toolkit. Or you can add somebody as a viewer, which allows them only to look at the DSPT but not to amend it. So, for example, if you are registering as an HQ and you want your registered managers to view what's within the DSPT, you could set them up as viewers where they can't edit it, but they can see what's within it. So it gives you a flexible range of options in terms of how to use the DSPT best for your organization. So should you want help with any of the registration process, there is support available. So again, within the Digital Care Hub, there is support available in terms of registering as a single site, or if the complexity of registering as a multi-site bewilders you, then there is guidance there as well. Or again, you can contact your local support partner. So by clicking on the links on the right-hand side of the slide, it will take you through either to the specific guidance on the Digital Care Hub website or how to contact your local support partner. So that's the registration process complete. And I'm going to stop there just to allow opportunity to see if there are any questions or anything regarding the process so far that hasn't made sense.
Yeah, just one question, Alan. Someone says, what happens if the administrator leaves the organization?
Right. I would suggest that as part of the leaving process, if it's possible and if it works in that way, that it is on the list of things that they should be passing on to another member of staff. Or if the administrator has left and hasn't left details in terms of how to log on to the toolkit, then if you contact the Exeter Help Desk, they should be able to reset your organization, etc. And if you contact them, particularly via an official email address from the organization, then it will smooth the process of authorizing you to take over the account, etc.
Fab, thanks. Just a couple questions more come through. Does
Yeah.
software include apps for the business?
Yes, it would be anything where there is digital access. So it's depending on whether or not it contains personal and confidential information is the critical element. If it contains personal and confidential information, then it should be part of your processes in terms of the data security requirements, etc.
Lovely, thanks, Alan. And just one more. This person says, we're a small organization and the director is also the administrator. Is this okay?
Yeah, it's fine. Doesn't matter who the administrator is, providing they're able to respond or get access to the responses that are required to complete the DSPT.
Amazing. Thanks, Alan. And that is just, oh, one more come through. Does that include WhatsApp for the care service?
Absolutely. Yeah.
Perfect. And I think that is
Providing,
questions.
sorry, again with the same proviso, that if it includes personal and confidential information that allows an individual to be identified, then it should be included within your data security arrangements.
Thank you for specifying. I'm sure it's useful to have that detail. That's all of the questions. Let me just double check, make sure no one's put nothing in the chat. Yep, that's all of the questions.
Lovely. Thanks, Rihanna. Right, okay, so let's move on to looking at how you work with the DSPT and specifically how you complete the questions in order to be able to achieve standards met, hopefully. So what do you need to do? So having registered, you've set the organization profile, you can click through to the questions. A few things that are worth mentioning in terms of your publication. The DSPT is a self-assessment. So that means that it relies on you as an organization, whoever is completing the DSPT, to answer with integrity. So no one reviews your responses to the questions. It is a self-assessment. It's also important to mention that your answers are not published. The only thing that's published publicly is your DSPT status. So if you achieve standards met, that will show on the public view. If you achieve standards, approaching standards, that's what will be seen. So the detail of what's within your responses is not publicly available. And just to stress that it is not a tick box exercise, that you should use it to work through what you need it to do. And the reason it's called a toolkit is because it's designed to be a series of prompts. So have you done this? Yes or no? Have you got this in place? Yes or no? It does rely on your integrity, and it should accurately reflect your specific data and cybersecurity arrangements within your organization. So you should be using the answers and comments to record the information that relates to where you are at this moment in time and updated wherever. And all of that helps with your future DSPT publications, bearing in mind that we've said it's an annual process. So having said all of that, you've registered, you've set your profile, and you're through to the questions. What does it look like? So if we have a look at what the social care view is, so if you've ticked social care as your organization type, you see what's called the social care view. And you can see that it says at the top, social care assessment. And it mentions there that if you only respond to the mandatory requirements, you will be asked to provide an action plan. So some of the questions, as you can see on the screen, have got mandatory next to them. Some of the questions haven't. So if you only respond to the mandatory questions, you will only be able to publish to approaching standards. You will need to answer all 45 questions in order to achieve full standards met. Under each section within the toolkit, there are several questions, or what are referred to as evidence items. And depending on the type of questions, you will asked to either upload a document, write something in a text box, or tick the box to confirm that you are compliant. So there's three types of question: upload, text box, or tick box. That's the only three types of questions that are within it. And if we then now look at what the questions look like as we work through, you can see that two of the sections within the toolkit are visible on this particular slide: staffing and roles, policies and procedures. To respond to a question in any particular section, and I should say that you can work through the toolkit in any order, the system will automatically save periodically, so your responses will be saved, and it doesn't matter which order. You don't have to work through it from top to bottom. You can respond to the easy ones and then come back to the more difficult ones as you work through. But in order to answer the questions, you click on the text and it will open up the full question together with some guidance that will help you to know how to respond. So if we have a quick look at how the questions are structured once you've clicked on it. So 4 sections: staffing and roles, policies and procedures, data security, IT systems and devices. Different number of questions within each section. If you want to achieve approaching standards, there are 26 mandatory questions that you will need to answer. If you want to achieve standards met, there are 45 questions in total, which is the entirety of the social care DSPT. Staffing and roles is about having a named person responsible for data security and protection. It's about induction processes, and it's about ongoing training that covers data security and protection. Policies and procedures includes being registered with the Information Commissioner's Office, having data protection policies in place, having a records retention schedule and privacy notices, and about good practice in relation to destruction of records and computer equipment when no longer required. Data security relates to the building and physical security in place for paper records, plans for what to do in terms of your business continuity planning processes, etc., and managing data breaches. if something goes wrong. And then IT systems and devices is about basic IT good practice, covering things like antivirus, software, etc. And this is often the one where people may refer to whoever provides their IT systems just to check that they've got the right responses in place. So in order to respond to the toolkit, you just respond to each of the questions as I've indicated. And if we look at the questions in a bit more detail, we can start to see how you need to respond. So if we look at staffing and roles, what do the questions cover? Who's got responsibility for data and cybersecurity within your organization? Your staff records and contracts that they have, and do they include sections around data and cybersecurity? And then the training that people have in terms of keeping people's personal and confidential data safe. So it will also ask about what training do staff have? And there are resources available within the toolkit and within the Digital Social Care Hub that will help you to understand what training people need and provide you with some tools to be able to provide that. So let's look at it in a bit more detail around staff records. If we talk through one example now, just to show how it works, it's important that we keep both staff and volunteers, etc., records up to date, keeping track of any change of role, etc., and the removal of leavers, etc., which may be linked to payroll systems, rostering systems, etc. And the question specifically asks, does your organisation have an up-to-date record of staff and volunteers, etc., and their roles? Which may seem like a fairly straightforward question. However, the reason it's there is because it's really important that you understand what people do and what level of access they should have to people's personal and confidential information. It's really critical that that is able to be tracked, particularly in terms of ensuring that you can demonstrate due diligence should there be an issue around data security, etc. So if we then move on to have a look at where that question sits within the toolkit, we can see that it is the last question in the first section of staffing and roles. So if you click on that text, the blue text following the 411, it will open up the question as I indicated, which will show you the full question and the guidance that's available. So bold lettering at the top, the question itself, and then some guidance in terms of what you should do and how you should do it. So this is the bit that you would check to see if you are compliant. So if you have the list of staff and volunteers, it's up to date, and it includes the information that's included in the text there, then you're in a position to respond to the question, which is in this case a tick box. So up on the top left of the question, you'll see the orange square, and all you need to do is to check that box and you will have responded to the question. If you wanted, you could use the comments box to indicate where those records are kept. You don't need to upload those records to the system. You just need to indicate that you've checked and you're happy that it meets all of the requirements. Having ticked the box, you would then click on the blue box for save, and the question would then show as completed within the toolkit. If we have a look at a question response, a sample response to the question, we can see how easy it is to complete that particular question. So do you have an up-to-date record, etc.? Yes, so you've ticked the box, and in the comments box, you can see that we've entered here some information about where it is and how to access it. So again, relating to the question earlier, what happens if your administrator leaves and you're not sure where the record is? The comments box will have told you where that information is. So fairly straightforward process in terms of completing the tick box question. So now, let's have a quick look at some of the questions and how they work as a totality. So if we look at question 115, which is also in the first section of the toolkit. It states who has responsibility for data security and protection and how has this been formally assigned. So that's the question. The tooltip is the text underneath that gives you more information. So it just says basically what you need to do as a business in order to respond positively to this question. And you can see that there are some blue text links that will take you through to further information if you're not sure what it's referring to, such as a data protection officer called Guardian, or if you want to look at the Digital Care Hub website, where there might be more guidance available. So we have the question at the top, the tooltip underneath, with potential links through to other information. And this particular question is a text question, so it's asking you to type your response into the top box there. And then again, we've got the comments box, which you'll see is marked optional, where you can add any comments that might be useful in terms of leading people in the future to where the information is. So another question will relate to training for staff. And if we have a look at what that's asking, question 321 is asking, have at least 95% of staff, directors, trustees and volunteers completed training on data security and protection and cyber security in the last 12 months. So this question is indicating that training on data security and cyber security is not just within the induction process for staff, but it should be an ongoing process for all staff within the organisation. So for standards met, you will need to complete this because it is a mandatory question. It is an optional question. And we are frequently asked about what training is available, as I mentioned earlier. So Better Security, Better Care have developed some resources to help you with being able to ensure that you are meeting all of the requirements. So there is a free e-learning course, and this is aimed at all staff at all levels working with adult social care. A series of 4 modules around data protection rights, keeping data secure, threats to data security and data breaches and what to do about that. All of this is easily accessible. Each of the modules is around 15-20 minutes. And it's based on case scenarios that relate to social care. So it is relatable to the services that people are working in. And as I say, it is completely free. It is for all staff at all levels. And if staff complete this, then you will be compliant with question 321 on the toolkit around data protection training for staff. For those with more responsibility, there is also a similar programme for data leads working in adult social care. So those with greater responsibility around data protection. Again, it meets all of the same criteria. There are 4 modules, 15 to 20 minutes each, based on case scenarios, but it goes into it in more detail. So it's tailored learning for those leading on data protection and cyber security. Just to emphasize that it is free, completely free. You don't even need to register in order to access it. And there is a link at the bottom of the slide that will take you through. Additional resources that are available are a cyber game, which is an interactive educational simulation of cyber attacks in social care settings. So if you wanted a fun activity for a team building event or a team meeting, etc., there is this game that's available completely free. That's an interactive online game set in a social care environment, and it's looking at what do you do if there is a cyber attack. So people would choose a character, the role within the service. They would then work their way through a cyber attack scenario, making the decisions and getting feedback on the decisions that they're making, and then getting scored on several elements such as security, time and cost. And then you can replay it with different roles, explore various outcomes, etc. So again, a link on the bottom of the slide that takes you through to be able to access that. Again, you don't need to register, it's completely free and accessible. And then there are also some managers tools available from Better Security, Better Care. This is the manager's discussion tool and quiz for staff, and this can be particularly useful in terms of working with staff. Again, can be used, for example, after training to check that the frontline staff who have received their training actually understood what it is that they've been trained in and that they understand the process for keeping people's data safe, etc. So again, completely free, completely available to anyone who wishes to use it. And then there is an additional resource available for managers, which enables them to assess their own understanding of how it works. And then there is the resource in terms of helping you to respond to the questions that ask about policies and procedures within your organization. So quite often have come across providers who want to check that the policy and procedure they've got meets the requirement. And you can use the resources available on Better Security, Better Care to double check that what you've got, or you can use them in themselves. And one of those resources is the BYOD policy builder. So that's around bring your own device. So you can develop a bring your own device policy for your organization from this tool. So you can customize your data and cyber policies to fit with the requirements around how should we be making sure that if people are using their own mobile devices in the organization, that we have covered all of the things that we need to cover in relation to data protection. So this is the first of the data policy builder tools that's available, and there are more policies to follow, etc., to help you with all of that. So planning around data quality, data protection, data security, etc., etc. So it should eventually cover all of the elements that enable you to respond positively to the questions within the toolkit. So let's move on to have a look at the next section of the toolkit. Policies and procedures, what do the questions cover? Well, the first is around the Information Commissioner's Office registration. It also asks about those policies and procedures that I've just been referring to. Do you have up-to-date data protection policies? What should they include? Do you carry out audits and spot checks on people's compliance in relation to the policies that you have? Are you compliant with the national data opt-out? And that may be a new concept to you, but it has been a requirement since July 22, and it is now a requirement on the DSPT for standards met. So you need to confirm that you are compliant with the national data opt-out. What do you do about holding and sharing information? Again, the aspects relating to retaining records, how long do you keep them for, what do you do with them when they're no longer required, how do you dispose of them when you want to dispose of them? And then, do you have a list of suppliers who handle personal and confidential information? So it might be IT support, accountants, DBS providers, HR payroll, etc. All of those that have access to personal and confidential information. Do you know who they are, how to access them, and are they compliant with the data protection requirements? So let's have a look at one of the questions within the policy and procedures section, and we'll start with the Information Commissioner's Office. So just to state that registration with the ICO is a legal requirement for every organisation that processes personal information. And by processes, I just mean uses personal information. Unless they're exempt as a small charity, and it's highly unlikely that a social care provider would actually meet that criteria. So it's highly likely that you will be required to be registered. And if you're not already registered, then I would suggest you do so, because there is a possible fine of up to £4,000 for not registering with the ICO. So there is a specific question within the toolkit relating to the ICO, and it simply asks, what is your Organisation Information Commissioner's Office registration number? So there is the requirement to register, so you should have a registration number. And it's possible to check what the registration number is if you're not sure on the ICO's website. And it simply asks you to enter the number within the text box, so the top box on the slide here. The registration number usually starts with a Z, and you simply type that into the text box. If you wanted to, you could in the comments box say where the certificate of registration is held in the office, etc. And then having completed that, click on Save, the question is complete. So if we then have a look at a sample completed question, what is your Organisation Information Commissioner's registration number? You can see that they've entered the number starting with Z within the text box, and this particular organisation have put details in terms of when they registered and where the certificate is held within the organisation. So if you work through the toolkit, working through the questions in any order that you wish, and you come across a section you're not sure about, what can you do? Well, there is lots of support available to you. So again, just to re-emphasize what's available, with regard to policies, etc., there are a number of template policies currently available on the Digital Care Hub website. And again, bearing in mind, there is the policy builder that is gradually developing more and more that you can use to develop your own. But these are templates that you can download and personalize to your organization. You can see that for approaching standards, there is a list of the required policies that you will need there. For standards met, there are some additional required policies, and they're all available via the link at the bottom of the slide. And then there is some recommended documentation that you might use within your organization, such as a security breach incident reporting form, an assignment form for mobile devices if you're issuing them, etc., and the template suppliers list. So there is a whole range of support to enable you and facilitate you being able to get in place the things that you need to have in place in order to respond to the questions within the toolkit. So moving on to the third section on data security, what does it cover? Data breaches, so it asks if you have a system in place to report data breaches. And it asks about near misses, and it also says what your plan should cover in relation to data breaches. So if you haven't had a data breach, it is perfectly acceptable within this section to write in the text box, in the comments box, not applicable, and still tick the question to show that you are compliant. However, before you glibly say we haven't had a data breach, I would suggest it's well worth checking out what constitutes a data breach within the organization, because it's quite common for organizations to be surprised at the breadth of things that constitute a data breach. So I would suggest researching a bit before you respond to this particular question per se. But the important thing is with this question, it is possible to put not applicable if that is the reality. This section also asks about the physical security in terms of the building. So what locks have you got? How do you make sure people can't access confidential and private information? What do you do about paper records should you need to remove them from the premises, such as on a hospital visit, etc.? And then lastly, it asks about business continuity. So what do you do in data emergencies? What should your plans cover? And how do you make sure that those plans work? So does your business continuity plan include data and cyber security? If it does, have you checked that it would actually work should it happen? And then moving on to the last section of the toolkit, IT systems and devices. This one looks at people and their access to information. So that relates to what I was saying earlier about the list of staff, their roles, and understanding what level of access they should have to personal and confidential information. It asks about your password practice within the organization, making sure that people aren't sharing passwords, that they're not on post-its on the computers, etc. How do you manage backups of personal and confidential information to make sure that you could continue business as usual should there be an issue? How do you protect devices to make sure people can't access confidential information that's within them? What's your technical setup and support? And again, this is a section that you may want to ask whoever provides your IT support around. And then what documentation should your suppliers have to prove that they know what they're doing in relation to data security and cyber security, etc. So there are a couple of bits that are worth mentioning in relation to this particular section. So there is a new mandatory question that's been added recently. Question 453 asks about multi-factor authentication. So multi-factor authentication is considered to be one of the most effective ways to protect your data and accounts from unauthorized access. And we should consider it for all systems that can be accessed from the internet. So things like your email, digital social care record, any cloud-based or online systems that you operate. And we need to make sure that those are either protected with multi-factor authentication, or if there is an exception to that, why we feel that it's safe to do that. So guidance on implementing MFA can be found on the Digital Care Hub again. And there's lots of further information and guidance being developed to help understand what it is. But just so we can understand what we're talking about, basically MFA is a way to make your online account safer because you add in extra steps that prove that it's you logging in. That will usually be a text message, email code, fingerprint, or you can use authenticator apps such as the one on the right-hand side there, the Microsoft tool. And we've probably all done it when we've been using online banking or logging into social media, etc. It's been used increasingly across most systems that have personal information on them. And basically, it's about ensuring we keep us all safe by only allowing people to have access who should have access. So what do we need to do? So we need to review our current systems and possibly speak with suppliers where relevant to understand what we've got, what we need to think about. We need to be identifying any potential issues. So do staff share devices or logins, etc. That creates a vulnerability. How can we overcome that? Identify where implementing MFA might not be appropriate. So if we do already have other controls in place, we might not need to use it. And decide on your organization's balance of security versus usability. So we don't want to put people off using the systems, but we also want to make sure that we're fulfilling our responsibilities in terms of keeping that data safe. If we decide that we're not going with MFA for any particular system or device, then that should be approved at director or board level with a justification as to why we've done that. And again, it's about providing due diligence, so evidence of due diligence in terms of our data and cyber security. So important not to go overboard. Systems must be usable. We don't want to add too many layers. Again, we don't want people to find workarounds. Identify what's the appropriate level of security based on the sensitivity of the information. So what's the balance of risk versus compliance? So where appropriate, it should be implemented for all individual logins or systems. And if you're not sure, use the support that's out there. So your local support organization, your software supplier, your IT supplier, all of this will be familiar to anyone who is competent providing your IT services, etc. If you do want more information, then it's available again on the Digital Care Hub website for all of the sections that we've covered. If you feel it's appropriate, you can contact your Better Security, Better Care local support partner, and they will know how to support you through all aspects that we've been covering. And again, you can register for free updates on the Digital Care Hub website. So having completed the DSPT, gone through all of the questions, whether it's approaching standards or standards met, you're then in a position to publish your DSPT and to make your status public. So what do you need to do? If you're publishing at approaching standards, so you've responded to the 26 mandatory questions, if you scroll down to the bottom of the screen, there will be a blue box that says publish the approaching standards assessment. So if you click on that, it will then open up what you see on the bottom right of the screen there, which is a request to provide an action plan. So it will enable you to download a form for you to complete, which asks you about how you plan to complete the rest of the questions within the DSPT. What steps are you going to take and by when? It will then ask you to upload that action plan to the toolkit, and then it will facilitate you to publish at approaching standards. However, if you've answered all 45 questions, then if you scroll down to the bottom, the blue box will say publish assessment. And that will enable you to complete the toolkit at standards met. Bearing in mind, again, that the only thing that's published publicly is your status on the DSPT, so standards met or approaching standards, not the answers that you've put into the toolkit. When you click on the blue box, it's possible that you may get a pop-up that indicates that there is a problem with your submission. So if you haven't responded to one of the questions, it will indicate what that question or what those questions are. Or if indeed you've typed your response into the comments box and not the text box, it will also show as not complete within the toolkit. So if you click on the red text, it will take you through to the relevant question and you can address whatever the issue is. And then once you've completed all of the queries in relation to the DSPT, again, you'll be able to click on the blue box at the bottom to publish your DSPT. If you were registered with an HQ code and you were publishing on behalf of other sites, then you will see what's on the screen here, and you can see the arrow is indicating some blue text that says view branches. So if you click on that, it will open up all of the locations that are linked to this HQ ODS code, and you can tick the ones that you wish to be included within this publication. And that's how you'll complete one DSPT for a number of services. Importantly, though, that you check they've got the same policies and procedures, IT systems and data security arrangements, and that will facilitate then publishing on behalf of either the whole organisation or this particular section of the organisation. Should you need further support on publishing, a couple of links on the slide here that will take you through, again, either to the specific guidance or to your local support partner who can work you through whatever support you need in whatever way you need it. Having published, you will then be in a position to either download your assessment in Excel. So you can download an Excel spreadsheet with your assessment questions and responses by clicking on the download assessment at the top of the screen. Or if you wish to save it as a PDF, you can then come out of your publication, go back in, go to previous publications, click on the appropriate publication, and if you click on view details, it will open up a PDF of the particular publication. And this is also where you can download your certificate to prove that you have published the DSPT at what level. If you wish to save it as a PDF, click on print or Control+P, making sure that you change it from the printer to save as PDF. click on Save, and it will download your PDF file. So once published, what do you need to do? I would suggest it makes perfect sense to tell people about it, because it demonstrates that you and your organization are serious about data security and cyber security within your organization. So tell all of the people that are on the slide here. And then just to summarize in terms of making the whole process real, it's important that you keep it up to date through the year so that any changes within the organization are reflected within your DSPT. Ensure that everyone in the organization understands what's expected of them around data and cyber security. And you may want to consider printing out the documents, etc., so that people understand what it is that you've said your organization is serious about. And just to summarize here, I would want to say that the DSPT is not the end process. It's not what we're trying to achieve here. What's important is that we're trying to demonstrate that the service is safe and secure, upholding the rights of the individuals you support. So it's a means to an end. It's about ensuring that data and cybersecurity are embedded by design and default within our organization. So next steps that you might want to consider: registering on the DSPT if you haven't already done so. All of the links are there to help you to know where to go for support, etc. And then lastly, are there any questions that we haven't responded to so far?
Hi, Alan. Yeah, I'm actually just frantically typing away to a couple of questions, so I'll just give these to you. Does 4.1.1 include temporary or agency staff?
Absolutely.
Perfect. This person says, our organization has already achieved ISO 27001 certification. Is there anything in the DSPT self-assessment that doesn't align with ISO 27001 controls that we should consider before registering?
Not really, but it will still be helpful, I would suggest, because it will mean that having completed all the steps for the ISO, it will make it very straightforward to complete the DSPT and possibly even get to exceeding standards, which will then be helpful in terms of demonstrating, again, that you are serious about data and cybersecurity.
Amazing. Thanks, Alan. And that's all of... Oh, wait. I think we've just had one more.
Okay.
Oh, no. That's the same one. Sorry.
Okay.
That's all of the questions there for you. Thanks so much, Alan.
Thanks, Rihanna. Okay, so just one last thing before I let you go back to whatever you intend doing later this afternoon. If you wouldn't mind completing an exit poll that gives us an idea of how you felt about the session and how we can improve it in terms of future participants. So again, just indicate your appropriate response, work through the questions. What impact has the webinar had on your confidence? Is it likely that you will complete and publish? Will you contact your local support partner? Would you recommend the webinar? And then lastly, where did you hear about us? And once we've got responses to that, okay, have we got the responses there, Rihanna? Oh, excellent. 100% increased confidence. 60% of you say that you will go on to complete the DSPT. Splendid. Local support partner, around just under half of you will contact your LSOs. And would you recommend the webinar? 100%. Splendid. Excellent. It would appear that people are happy with the job we've done. And then lastly, it just remains for me to say thank you very much for attending this afternoon, and I wish you best of luck with your DSPT in the future.
Amazing. Thanks so much, Alan.
Pleasure.